All right, welcome back. We have a very important topic to discuss today. We are in the month of September, and that is also Prostate Cancer Awareness Month. I want to make sure that you know the risk and the developments with this disease, so we have in the experts to give you that information. USA Health's Dr. Christopher Keel. Thank you so much for stopping by.
Thank you. Thanks for having me.
First, I have to ask you, are you okay from the storm?
Yeah, absolutely. We're blessed at my house. We got power and no damage, so we're good.
Good.
So, yep.
All right, so on to the nitty-gritty here, right? I mean, this is very common, prostate cancer, but it's also very treatable when caught early.
Sure.
What are the signs?
So there's really no signs, and that's the big message that men need to understand. And what we see a lot is guys that come in because they're prompted for one reason or the other. Their wife sees them today, and they say, "Go get checked," and they say, "I don't have any symptoms, doc." And so there is no sign. So that's the reason it's important for early screening and to start that on a routine basis early. So yeah.
Okay. So in terms of the screening, is there a certain age that you need to look at?
Absolutely. So the American Urology Association generally recommends between 55 and 75. It depends on your health, though. It depends on your age, and it depends on your family risk factors. So African American men, I generally start earlier, usually at 45. Just get a single PSA, which is a blood test to see what their risk is. For white males, we usually start around 50, but it just depends on the patient, and it really just starts with a conversation with your doctor. So
there you go.
Yeah.
And it's simple enough. Get that PSA tested. And I guess my question to you is, but as long as we've been dealing with this, there's still no treatment.
Well, there is treatment, and there is a cure as long as it's caught early. There's treatments. So we've had 5 or 10 different new treatments come out in the past 10 years.
Okay.
And so there's really new stuff coming out all the time. And what I tell people is, if you don't treat prostate cancer all the time, you're going to probably be behind on what the newest, latest, and greatest is. So I think the take-home message for most guys is that the treatments that we have now are not the same ones we had for our grandfathers, and that's what we want to compare everything to. But people now are that we've seen the death rate go way down with the introduction of new treatments since basically PSA testing came out. So.
Okay, all right. So that is the big deal. Make sure you get that screening.
Make sure you get the screening. Yeah, September comes, football starts. It's time to think about your prostate. So
that's a good reminder.
Yeah.
You know, really quickly, I was reading a study and it indicated that belly fat can sometimes be an indication of that. Should you read too much into that, or?
Well, I think you have to take everything. You have to understand where some of the data comes from, but we know that people that are obese are at a higher risk. We know that an American diet, which also makes you sometimes obese, puts you at a higher risk. And so I usually tell people that heart-healthy diets and healthy diets lower your risk. So there's things that you can do to prevent it, and exercise has been shown to prevent it. A heart-healthy diet's been shown to prevent it. So there are prevention methods.
All right. Well, thank you very much, Dr. Keel, for stopping by.
Sure. Thank you.
Any screenings coming up, or was that information on the website for you
That
guys?
information should be on our website. It's certainly, we screen routinely at our office, so I know that there's some local community events that are coming up, and so those things are definitely pay attention to. So it's just an annual visit. It's just a needle stick, man up, and get checked.
Yeah. Okay. And on that note, we appreciate you. Listen, you can find this interview on our YouTube page. We'll get it posted for you shortly. That way you'll be able to watch it or share it with someone you know. Again, thank you.
Sure. Thank you.